Okay, United States Medical License Exam, Step 1, First Aid, 2025, Reading, Complement. So a complement is a system of hepatically synthesized plasma protein that played a role in innate immunity and inflammation. So they are created probably in the liver. That's what they say, hepatically synthesized plasma protein that played a role in innate immunity and inflammation. So the membrane attack complex is a pore-forming complex in the complement system that damage and kill target cells, including pathogenous and host cells. It's formed by the assembly of a whole group of complements, especially the C5b, C6, C7, and C8, and C9. The membrane attack complement disrupts the cell membrane, causing uncontrolled ion and water influx, leading to the cell death. So the membrane attack complex is formed during the final step in the complement cascade. We're going to see down there. What is the complement cascade? It is a crucial part of the innate immune response, as we said before. So the membrane attack complex, it defends ourselves. It defends against gram-negative bacteria. So the CH50 test, CH50 test is used to screen for activation of the classical complement pathway. So the activation of the pathways, let's read about the classic pathway. So activation of the classic pathway, we're going to have immunoglobulin G and immunoglobulin M mediating this process. So remember, classic pathway, we're going to have immunoglobulin G and M. So the mnemonic is for this is General Motors make classic cars. General Motors make classic cars. So General tell you the IgG, Motors tell you about the IgM, and the classic tell you about the classic pathway. So the classic pathway for activation of the complement or classic complement pathway is IgG and IgM, like General Motors, and is the classic one. Okay, so the alternative one is mediated by bacterial products. Alternative is mediated by bacterial products. So alternative is mediated by bacterial products. Okay, classic one is IgG, IgM. So the next one is lectin. So this pathway, the lectin pathway, is essentially gives us defense against microbial infections by recognizing or binding to a specific carbohydrate in this microbial. So the lectin pathway is one of the three pathways that activate the complement system. It's part of the innate immune system too. So this whole process starts when they recognize the specific carbohydrate structure in the microbial surface by a specific protein called lectin. So that lectin binds to their specific ligands and triggering a cascade that leads to activation of the complement protein. So that's another way. That complement get activated. So remember, lectin, alternative, and classic way. That's the three ways. So the lectin is in both mannose and other sugars in a microbe surface. So they recognize in the microbe surface the sugar and the mannose. This is the lectin way. So remember, the classic way, General Motors make classic cars. The function is, let's see the functions. So we have C3V, that's the one more specific for opsonization. C3V, C3B. So the C3A, C34, and C358, all of them 8, they're more for anaphylaxis or allergic reaction. You can see the 8 on C3A, C4A, and C5A. They give you the mnemonic for, remember, anaphylaxis. C3A, C4A, and C5A, they're more for anaphylaxis. The C5A2 by itself, it attack neutrophil and chemostasis. So the C5A, instead of saying attack, they call to the area or inflammation area, they call the neutrophilos. Chemostasis mean bringing in into the inflammation area, neutrophilos. So the C5A, they produce neutrophil chemostasis. Neutrophil chemostasis is C5A. Remember, C5A is in anaphylaxis too. C5B9, or is the membrane attack complement. C5B9, C5B9 membrane attack complement is cytolysis or killing. Cytolysis. Remember, the MAC complement defend us against gram-negative bacteria. C5B9 MAC complement cytolytics. So the mnemonic that they have for this is get a nice big Mac from 5 to 9 p.m. You're gonna get really a lot of gain of weight if you eat a Big Mac every afternoon from 5 to 9. You're gonna get big Mac. So remember this: get a nice Big Mac from 5 to 9. That's gonna remind you that C5B9 is the MAC complement, membrane attack complement, and they produce cytolysis. So the C3B bind C3B, that's the only one B except for C5B. The C3B bind to the lipopolysaccharide on bacteria. The C3B bind to lipopolysaccharides on bacteria. I repeat because sometimes you guys driving and you can go paying attention what I said. That's why I usually like to repeat. Sometimes this is good, so if you have like a long drive or something like that, you can go hearing my voice. That is not the best one, but you can hear my voice, and you can something go through your mind, and something stay there. So that's all I like to repeat. So C3B is for opsonization. C3B is for opsonization, and the C3B binds to the lipopolysaccharides on bacteria. The MAX complex is important for neutralize Neisseria species. The MAC complex is important for neutralizing Neisseria species. The MAX complex deficiency result in recurrent infection. So MAX complex is important in neutralizing Neisseria species. That's why they tell you needs to get a nice MAC from 5 to 9. Remember those two. So in your mind, think, don't look the book. C3B is for think. 3 seconds. Opsonization. C3b is for opsonization. Opsonization. C3a, C34, I'm sorry, C3a and C4a and C5a is for anaphylaxis. Anaphylaxis. So don't look the book. And then C5a by itself is for C5a by itself is for neutrophil chemostasis. And C5b9, the max complement, is for cytolysis. Okay, this is a good like a practice, so you can just don't look the book and look in your mind, close your eyes and look in your mind and try to answer the questions that we just learned. It's like you put your brain to work, whatever they just learned. So opsonins, let's see what is opsonins. So the C3b and immunoglobulin G are the two #1 opsonin in bacterial defense. They enhance phagocytosis. The C3b also helps to clean immune complex. So the opsonins, the C3b and immunoglobulin G, C3b and immunoglobulin G are the two #1 opsonin in bacterial defense. They elevate the phagocytosis, and C3b also helps to clean the immune complex. So the inhibitors, so it's important that this whole process of destruction or cytolysis doesn't destroy your own cells. So that's why we have the inhibitors. So they decay acceleration factor. The inhibitors decay acceleration factor DAF, or also called CD15. So the decay acceleration factor and the CD1 inhibitor, they prevent the complement activation on self cells, by example the red blood cells. So the C1 inhibitor and the decay acceleration factor DAF or CD55, they are the main inhibitors to prevent the complement to activate on our self. So we have this question here, very similar that we just learned. Let's read. This is a 3-year-old girl. She brought to the office after developing a fever and sore throat. Patients recently entered a daycare and similar symptoms have been reported in several older kids. So physical examination show exudative pharyngitis and enlarged anterior cervical lymph nodes. A rapid antigen detection test confirmed the diagnosis of the Streptococcus strep infection. Her condition resolved with antibiotics therapy. Several weeks later, she is re-exposed to the Staphylococcus pyogenes. So the bacteria penetrating beyond the surface epithelium are immediately coated with preformed immunoglobulin antibodies. So which of the following substances act in the most similar manner like the immunoglobulin G antibodies for facilitate the phagocytosis? So which one of the next work with the immunoglobulin G to facilitate the phagocytosis? So you guys think, you guys read, think a second and pick. So the answer is complement C3b. Complement C3b. So as you can see in the graphic here, so the bacteria come through the membrane, and you have opsonization through the immunoglobulin G and the C3b. So they they present this bacteria into the macrophage. So there's we read this before, FC receptor here. That's the binding place, and C3b receptor. They recognize the bacteria, and then they start the process of phagocytosis. So opsonization happens when the host protein, such as immunoglobulin or complement, bind to the surface of foreign cell, by example of bacteria. That happens when host protein, such as immunoglobulin or complement, bind to the surface of a foreign cell. To promote phagocytosis, the most important opsonins are immunoglobulin G and complement C3v. By mannose-binding lectin or C-reactive protein can also opsonize cells. So after opsonizing, the bacteria are bound to the cell surface. They act as a handle to receptors and phagocytosis, for example, Fc receptor and C3b receptor, to grasp, allowing the phagocytosis to more easily engulf the foreign cells. So they help to the monocyte of monocyte to phagocytose the bacteria by handing with those receptors. So the importance of C3 is demonstrated by the fact that all the three complement pathways, the lectin, the classical, and the alternative, converge on it. So the C3, the whole pathway, the whole three different pathways, they all get into the C3, the complement C3. So they all converge on it, resulting in cleavage into the C3A and C3V. C3A help to recruit phagocytic cells and induce inflammation. The C3B, in addition to acting as an opsonin, can bind to the C3b converter and form C5 converter, ultimately triggering the membrane attack complex. So we have to keep in mind the option number D here, the option D, that generally the C3b usually bind to immunoglobulin G. Remember, the M and G, they are like General Motors, they are the classic pathway. But don't get confused that C3v most likely C3b most likely bind to immunoglobulin G, because here they have as an option immunoglobulin M. So they say immunoglobulin M can be a potential stimulator for C3v opsonization via activation of the complement cascade. There are no receptors on the macrophages for the Fc portion of the of immunoglobulin M, and it does not directly enhance phagocytosis, unlikely immunoglobulin G, that is the one who usually bind to the C3b for enhance macrophago phagocytosis. As we all just learned in the question before, they said all the classic, all the pathway, the alternative, the classic, and the lectin pathway, they all converge in C3. They all converge in C3, as you can see here in the graphic. They all go straight into the C3. So as you can see here, so the alternative way, the whole process go into the C3. The C3 is the common way, the common key for all of them. Remember the lectin one, the one that sugar and mannose, you can see here. The classic one with remember classic car, GM make classic cars, General Motors, so immunoglobulin G and immunoglobulin M. And the alternative, we have here C3, followed C3b in the microbial surface. So all those three cascade they go straight into the one of those three different options. So we're gonna have, once the cascade is activated, either one way, alternative, classic, or lectin way, they're all gonna conclude in a inflammation, in a cytolysis or opsonization. So remember, the most common that we learn is the opsonization. You have the C3b here, you got the complement activated, and they're gonna be macrophage is gonna do a opsonization, then phagocytosis. So the another action we just read before is that cytolysis. Remember the one who act here as C5b, the C6 and C9. Remember, from 5 to 9 a big mag. So the mag membrane attack work here. This is for cytolysis, okay? And the other one here on the top is C3a, C5a. Remember, all the A's are for anaphylaxis or allergy. So C3a and C5a stimulate mast cells degranulation. When the mast cells degranulate, they're gonna release histamine increase, and endothelial permeability. So that's why it gets swelling and red. There's a lot of histamine. That's inflammation or anaphylaxis. And remember, the C5a by itself mediate neutrophil and chemostasis. This is very graphic. This is a whole graphic that we just learned at the top and the page before. This that we learn here: C3a, C4a, and C5a. All this for anaphylaxis. The C5a by itself is neutrophil chemostasis, and the C5b to C5b till 9 is going to be the max complex, and it's gonna do cytolysis. It's the same thing we can see here in those different square. And remember, the common pathway is C3, as we read in the question before. So we can read now about the complement disorders. So we have two type of complement disorder. We have the complement protein deficiencies when they have deficiencies, and we have the complement regulatory protein deficiencies too. So complement regulatory when they're low, and when they are too high, something like that. So complement protein deficiencies, we have early complement deficiency, C1 to C4. Early complement deficiency, C1 to C4. I'm not sure if the early complement refers to the early in the numbers or early in life. I'm assuming it's early in the numbers. It makes more sense because it's C1 to C4. So early complement deficiency is C1 to C4. There's going to be risk of severe and recurrent pyogenic sinus and respiratory tract infection. It's going to be a high risk of severe, recurrent, pyogenic, and sinus respiratory tract infection. The C3b, it's used in clearance of antigen antibody complex. So C3b used in clearance of antigen antibody complex. That's going to give you a higher risk of a lupus erythematosus systemic or systemic lupus erythematosus. The mnemonic will be think early. Think early. In this case, think slowly. Think slowly. So early complement deficiencies is going to be C1 to C4, and it's going to give you a higher risk of pyogenic sinus respiratory and tract infection, and it's associated with a higher risk of systemic lupus erythematosus. So the terminal complement deficiencies. So in this case, it's gonna give you this is the early C1 to C4, and the terminal, the last one, is to C5 and C9. So that's the complement protein deficiency. So deficiency of C5 to C9 is gonna give you a higher susceptibility to recurrent Neisseria bacteria, high susceptibility to recurrent Neisseria bacteremia. We see before here. So remember we saw this before here. So the MAC membrane attack complex is associated related with a C5 to C9. So this is the last or the later complements, and is associated with Neisseria species infection. So I don't know if graphically you can see it better now. So real quick again, early complement deficiencies is going from C1 to C4. It's associated with severe recurrent pyogenic sinus and respiratory tract infection. The C3b is used to clearance anti-antibody complex and is highly associated with systemic lupus erythematosus. Think clearly. So the terminal complement, that means the last one, the 5 to 9, is associated with susceptibility to recurrent Neisseria bacteremia. Remember, the last one is for the later complements from C5 to C9. They are associated with Neisseria complement, Neisseria bacteremia, and remember, is associated with a MAC, membrane attack complement. So now we go into the complement regulatory protein deficiencies. Complement regulatory protein deficiency. So we have the C1 inhibitor deficiency. C1 inhibitor deficiency. I have seen this in a lot of questions, so it's very high yield. C1 inhibitor deficiency. It can cause hereditary angioedema due to unregulated activation of kallikrein, or because this kallikrein is going to give you bradykinin elevation of bradykinin is give you elevation of bradykinin. So C1 inhibitor deficiency is going to give you angioedema due to irregulation of activation of kallikrein. This kallikrein can give you elevation of bradykinin. It's characterized by a diminution of C4 levels. This is high GL2 because I have seen questions about C1 inhibitor deficiency. I'm gonna ask you which one is depleted, is lower. So the answer would be C4 levels. So you're gonna think that the answer would be C1 because it's C1 deficiency. But they tell you the levels of C1, and the question levels of C1 are diminuted. So which of the following will be in lower levels too? So remember, C1 inhibitor deficiency is associated with C4 levels deficiency or diminution. So C1 inhibitor deficiency causes hereditary angioedema due to unregulated activation of kallikrein. This is gonna give you elevation of bradykinin. This bradykinin is the one who's gonna give you a lot of angioedema, usually in the face. I can see patients look like this on hereditary angioedema. Keep it in mind. You can see a young woman with a episode of facial hereditary angioedema. Remember those terms. Kallikrein and elevation of bradykinin, and it's going to be C4 levels diminutions. Okay, let's get the next. It's going to be paroxysmal nocturnal hemoglobinuria. Paroxysmal nocturnal hemoglobinuria. The name tell you what is about. So it's going to be hemoglobinuria at night, and it's going to be like a sporadic, or more likely refer to suddenly. So paroxysmal tell you like a suddenly, like a right away, just start now, suddenly. So let's say suddenly nocturnal hemoglobinuria. Something to remember, and the other one that we just didn't say it, is that in the C1 inhibitor deficiency, the ACE inhibitor are contraindicated. So the ACE inhibitors, as I said here, are contraindicated. This is like every family, captopril, lisinopril, all the families ending in pril, they are usually ACE inhibitors, and they are contraindicated because then elevate or raise the bradykinin, like the deficiency in C1 deficiency elevate bradykinin, so the ACE inhibitors elevate bradykinin too. So again, paroxysmal nocturnal hemoglobinuria, there's a defect in the PICA gene or PICA gene. Let me do a correction. There's no PICA gene, it's PIGA gene, it's a G. PIGA, the PIGA gene, or the PIGA gene, the PIGA gene is important for the biosynthesis of glycosylphosphatidyl linositol, or GPI anchors. So the PIGA gene is important for the biosynthesis of glycosylphosphatidyl linositol, or GPI. The mutation of the PIGA lead to the paroxysmal nocturnal hemoglobinuria. We're gonna call it PNH. It's a rare in-care hematological disorder. So the PNH is characterized by episodic hemoglobinuria and anemia due to the red cell lysis. The PIGA gene is also associated with a few other conditions, including novel subtype of hemochromatosis and X-linked intellectual development disorder. So the PIGA, the PIGA gene, prevent the formation of the GPI that we just said before, glucosylphosphatidylinositol, for the complement inhibition. So as a decay acylation for factor DAF, CD55, and membrane inhibitor of the reactive lysis, or CD59. So this causes complement-mediated intravascular hemolysis and diminution of haptoglobulin dark urine. So we're going to be dark urine, as you see here in the picture. Can cause atypical venous thrombosis. For example, the Budd-Chiari syndrome, the portal vein cerebral or dermal thrombosis. The Budd-Chiari syndrome is when you have a big clot behind the vein that drains the liver. So the Budd-Chiari syndrome is a very rare condition characterized by obstruction of the hepatic vein, which carry blood from the liver to the head. This obstruction can lead to the liver damage and other complications. Another causes of Budd-Chiari syndrome could be a big clot or thrombosis because tumor, liver disorders, or pregnancy. Common symptoms will be abdominal pain, ascites, enlarged liver, fatigue, jaundice, portal hypertension. So remember, because we have deficiency of the defect in the PIGA gene, there won't be GPI. GPI is an anchor for the complement inhibitors, so decay acylation factor and membrane inhibitor reactive lysis. Those one, when you have this deficiency, you're gonna have complement-mediated intravascular hemolysis and diminution of haptoglobin and dark urine. We may have other atypical venous thrombosis like Budd-Chiari syndrome, portal vein thrombosis, cerebral thrombosis, and dermal thrombosis. The treatment is going to be eculizumab. That's going to be the treatment for paroxysmal nocturnal hemoglobinuria. It's going to be eculizumab. That's going to be an anti-C5 antibody. Inhibit terminal complement system and MAC function. Remember, terminal are from 5 to 9. 5 to 9. That's terminal. Terminal complement is associated with Neisseria bacteremia. Neisseria bacteremia. Remember, eat a MAG from 5 to 9. A MAG. And you're going to get Neisseria bacteremia inside the MAG. So this is important here to remember. Eculizumab is the treatment for paroxysmal nocturnal hemoglobinuria. You're gonna have dark urine, you're gonna have thrombosis complications like Buchiari syndrome, portal, cerebral, and dermal thrombosis. Remember that. Thank you, guys. Let's do a real quick resume. CH50 is the test for using the screening activation of classical complement pathway. Classical complement pathway is EGG and EGM mediated. C3b is for opsonization. C3A and C4A and C5A is for anaphylaxis. C5A itself is for neutrophilus chemostasis. Remember, C5b to 9 is the late part of the complement system and is associated with Neisseria, is associated with cytolysis, is associated with Neisseria infection. Okay, and remember the first part, C3a, 4 and 5, is associated with this deficiency with lupus, as you can see here, guys. So C1 inhibitor deficiency is associated with angioedema, facial angioedema, and paroxysmal nocturnal hemoglobinuria is associated with deficiency of the GPI, is associated with atypical thrombosis like Buchiari syndrome, and treatment is eculizumab. So we're gonna read this question now. We have a question here. This is a 34 years old man come to the office due to disabled fatigue. The patient was diagnosed with paroxysmal nocturnal hemoglobinuria 3 years prior and has required numerous blood transfusions due to anemia. The treatment will be initiated with a monoclonal antibody to complement C5. These patients require immunization and prophylactic pharmacotherapy to prevent infection with which of the following organism? So think about an answer. Pick one. You can pause the video and think about it. So the patient requires immunization and prophylactic pharmacotherapy to prevent infection in which of the following organism? I will pick, as we learned before, Neisseria meningitis. Neisseria meningitis. Let's see. Okay, Neisseria meningitis. Let's read about it. Okay, this graphic tells you that eculizumab mechanism of action. Eculizumab. Remember, we read that eculizumab inhibit C5 convertase. C5 convertase here. Eculizumab. This is very important right here. So usually what happens is in a paroxysmal nocturnal hemoglobinuria, you're gonna have the C5 converts. They convert the C5 into the C5b and C5a, and this get into the whole process to form the membrane attack complex. So if you take this medication here, so you're gonna block the C5 to convert the C5 into C5a and b. So for the MAC membrane attack complex, it won't be formed. You can see here on the graphic. So these patients has paroxysmal nocturnal hemoglobinuria. It's a condition resulting from decreased expression of complement inactivation proteins like the CD55 and CD59. So remember, CD55 and CD59 are complement inactivation proteins. They protect our organs or our tissues or from the complement activation. So remember, CD55, CD59 are the proteins that protect us from the complement, because the complement is kind of crazy, sometimes attack us. So the CD55, CD59 are the police officers to keep them under control. So if you have a proximal nocturnal hemoglobinuria, you're gonna have decrease, depression, suppression, decrease of CD55, CD59 on the surface of the red blood cells. This leads to an increased formation of the membrane attack complex. This leads to an increased formation of membrane attack complex, resulting in anemia due to the complement-mediated hemolysis. Resulting in anemia due to the complement-mediated hemolysis. Resulting in anemia due to the complement-mediated hemolysis. The patients with those kind of symptoms like fatigue, thrombosis, transfusions requirement are often treated with monoclonal antibody. This is the one we just learned, eculizumab. Remember, patients that have those kind of symptoms of fatigue, thrombolysis, transfusion requirement, they all are treated with monoclonal antibody, eculizumab. This one act on the terminal complement, remember, C5, 6, all other than 5, even the CD55 and CD59, the 59 tell you that is this act on the complement from 5 to 9. This is a good mnemonic. Remember, CD59 is gonna remind you that this whole process is related with the CD5 and CD9. So the eculizumab act on the complement, on the terminal complement, that we say CD5b and C9, which inhibit the formation of the MAC complex, so the MAC, membrane attack complex, and decrease the severity of the disease. You can read this part here. So, however, inhibition of terminal complement activity and MAC formation also result in loss of rapid complement mediated kill to gram-negative. So, especially Neisseria meningitis. So, which can be dangerous because it can give you catastrophic systemic disease. Therefore, patients receiving anti-complement therapy should be immunized against Neisseria meningitis and be given appropriate antibiotics prophylaxis, for example, penicillin. That could be another answer. Which one of the next medications could be given to this kind of patient? So the answer is penicillin, prophylaxis for Neisseria meningitis. So education objective, it is prophylaxis nocturnal hemoglobinuria may be treated with monoclonal antibodies to the complement component C5. This is the terminal component inhibitor. So increasing the risk of Neisseria meningitis infection. Therefore, those patients should be received immunization and antibiotic prophylaxis against Neisseria meningitis like penicillin. So in the next one, we're gonna talk about interleukin, important cytokines, interleukin 1, 6, 8, 12, 2, interleukin 2, interleukin 3. Okay, we're gonna read all this. Ooh, it's a whole bunch. So remember, hot T-bone stick help you to remember about the first 6 interleukin. Interleukin 1, hot T-bone is for fever. Interleukin 2 stimulate T cells. Interleukin 3 stimulate bone marrow. Interleukin 4 stimulate immunoglobulin E production. And interleukin 5 stimulate immunoglobulin A production. And interleukin 6 stimulate acute phase protein production. This is a good mnemonic to write down before you test in the paper that they give you. When you get into the room, they give you a paper and a pen, and you can write down whatever you remember, all those mnemonic, because they're going to be useful during the whole process of the test. So you can write down, be sure to remember hot T1 stick. All of this is important. We're going to see in the next video. Thank you.